Hello, my name is Dr. Brad Holmberg, co-founder of InvisalignDoctors.com. This tutorial is an abbreviated version of Invisalign clinical preferences. The full version of this tutorial can be viewed on our learning website, InvisalignDoctors.com. It is important to update your clinical preferences periodically. These preferences are applied to every case by the technician group that develops your treatment plan. Updating your preferences will simplify the ClinCheck development process. You can override these preferences once you start developing a ClinCheck. Here is how you open your doctor clinical preference page. Click down on the arrow next to your name and select Clinical Preferences. When you open the Clinical Preferences page, this is what you see. There are two separate areas. The left side are the global preferences applied to the first ClinCheck for all treatments, including additional aligners. The right side is for Phase 1 treatments. These are cases where 2 phases of orthodontic treatment is needed. Usually Phase 1 treatment is for pre-adolescent patients. More information is available about each item by clicking on the Learn More link. These are the first 7 items on my global preference page. Most of these are self-explanatory, but I will elaborate on a few of these. Please keep in mind that these are my personal preferences. There really is no right or wrong selection. But let me go ahead and explain my preferences. I recommend checking yes to passive aligners. If one of the arches finishes early, you will want passive aligners. I recommend checking no IPR for the first ClinCheck so you can develop the arches first. Arch expansion may decrease or eliminate the need for IPR. I prefer to delay attachments until stage 3 for initial treatment plans. This gives the patients an option just to ease into their Invisalign treatment and to get used to the aligners before adding attachments. Here are the next 8 items on my personal preference page. The blue text are default settings. On this page, I use default settings except tooth size discrepancy and apply virtual C-chain. I like spacing on both the mesial and distal for small laterals. This limits the amount of tooth reduction necessary for restorations. I prefer to include the overcorrection C-chain aligners in most of my cases. In the next slide, I'll explain what function they perform. And I recommend limiting expansion to less than 2 millimeters, which is a default setting. You can always add more expansion later before final approving, but expanding more than 2 millimeters increases the complexity of the case and can lead to unsettled occlusion at the end. So you need to be careful on the amount of expansion you allow in your cases. Here's a video loop showing how the C-chain works in the upper arch. Let me turn it on. Okay. They are overcorrection aligners and occur at the end after the regular stages. You can see anterior retraction is the only programmed movement. The lower C-chains work the same way. They are not always needed at the end, but can come in handy for a variety of reasons. Therefore, you want them for all of your cases. Here are some uses for the C-chain aligners. They can close open anterior interproximal contacts at the end. Apply upper only with a little bit of IPR to reduce overjet and improve the anterior bite. And you can apply lower only with a little IPR to relieve premature anterior contacts at the end. You can add special instructions to your clinical preference page. I highly recommend you do this. These instructions will be automatically applied to all your cases, including refinements, so you do not have to continue to submit these written instructions for every case. Here are my special instructions that I use in my preferences. Instruction 1 is to request hinge axis rotation mechanics for anterior tooth rotations. Now this has had a major impact on the outcome of my cases and also for the cases of doctors I mentor. I highly recommend you view a separate tutorial on hinge axis rotation in our learning website, InvisalignDoctors.com. go to the Clinical Preference module that's located in the Member Dashboard. Thank you for viewing this tutorial. Consider joining our community of Invisalign doctors on InvisalignDoctors.com. This tutorial and many more can be viewed in their entirety. Personalized case assistance is also available on our site.